Okay, so good morning. I'm really happy to be here, and hi to those of you I haven't had the pleasure of meeting individually yet. Like Ken said in that wonderful welcome, I'm Dr. Aila, and I'm here from Baltimore and wanting to talk to you today a little bit about some of the behavioral challenges that we know with individuals with 1P36, and then a little bit more about some of what you guys can do in terms of thinking about an applied behavior analytic approach. So this is really just sort of an intro, maybe helping you guys develop some questions if you're having behavioral concerns, questions you can start asking as you head back home, and things to start thinking about just in your day-to-day interactions with your child. So I'm going to quickly review some of the commonly occurring behavioral issues for individuals with 1P36, talk about some initial steps in the assessment process that you may want to start pursuing or looking into, reviewing some of the commonly occurring environmental triggers that lead to these challenging behaviors, and then talk very basics about some of the treatment options that you may want to explore in the future. So some things we know about 1P36 are that nearly 100% of individuals present with some degree of intellectual impairment or developmental delay, and that's going to look very differently across the board. Approximately 75% of individuals have no expressive language. That does not mean that they cannot communicate expressively, but just don't have that expressive verbal language that we expect from typically developing peers. Over 50% experience eye and visual abnormalities, and 28% experience some degree of hearing impairment or deafness. Now this is just a small snapshot of some of the complications or other symptoms that come with 1P36, but are they the ones that I want to really think about when discussing some of the behavioral challenges that you may be experiencing. So what we also know is that about 50% of individuals with 1P36 present with some degree of problem behavior or maladaptive or interfering behaviors. Many of those primarily include self-injurious behavior, often in the form of hand biting, more extreme temper tantrums or unexplained agitation, some stereotypic behavior, which can mean repetitive types of behaviors that can become problematic, as well as reduced social interaction. But there are, of course, a whole slew of other potential behavioral issues that may occur, and many of these are ones that are referral concerns to individuals who come to our program at the NBU. So that can be aggression, disruptive and destructive behavior, elopement, general noncompliance, as well as dangerous behaviors such as pica, which is ingesting or trying to eat non-food items. So one of the main questions that I think some of you have asked me here this weekend already are, when are behavior problems a problem? And that's actually not a question that I can answer for you. That's something that you guys have to answer yourselves. In terms of some of the things to think about is this behavior interfering with you or your child's family, your child or your family's quality of life? Is it impacting their ability to access appropriate educational or medical services? Or are you just concerned? If you're asking, is this a problem, then it might be a problem, and that you're concerned about what's happening there, and maybe something you want to explore more. Something that I ask all parents that I work with or try to get a sense of is if they feel that they're avoiding more and more situations in their community. Certainly I avoid some situations myself. If it's too hot, no, I don't want to go there today, you know, or ooh, this is the busiest time to go to the grocery store, I don't want to go today. So there's a certain, don't say if you're just avoiding some things that's a problem, but if you're really feeling like, man, we haven't done this in a really long time, and it's almost exclusively because of concerns about problem behavior, then that might be something to kind of trigger you to start asking some more questions or seeking some more help. So some of the important points. The answers are not quick and easy. So again, what I'm going to be talking about today is really just sort of some things to get you thinking. I'm not going to be able to solve maybe some of your problems, but want to get you thinking about how you have some control over starting to work on your child's behavior and how you can try to find the resources in your area that might help you. Problem behavior there's not one clear treatment path. Every child's different, as I said the other day, that even though there are some trends with the types of behaviors that kids with 1P36 engage in, that doesn't mean that why they're engaging in these behaviors is going to be the same across the board. And that means that the treatment approach is going to vary from child to child. That being said, the assessment piece takes time. A lot of what I'm going to talk about today is that we really want to emphasize figuring out why your child's engaging in these problem behaviors and not just make guesses. So if any of you who met with me yesterday, I was saying this could be what's going on, so here are some things to think about, but here's how you might want to explore that further, because I don't want to guess as to what could be going on, because that could lead to some poor outcomes, and I'll talk about that a little bit later too. We really want to understand as much about the behavior and what we call the functions, and that's those whys a problem behavior is occurring, to understand how we want to provide some intervention or what approach we want to take with intervention. So that means treatment also takes time. So, our model of services, which I won't get into today, but I often talk to parents, it's a marathon, not a sprint. We want to take our time, gather the data that we know and feel confident about before we start trying to change what's happening at home and implementing some of these recommendations. So there's not ever really a quick fix. So some of the general first steps. So going back to that slide where I talked about some of the vision impairments and hearing impairments, one thing to first rule out or at least evaluate medically are the degree of those impairments, and I'm sure most of you have already done that. But the reason that that's relevant in terms of behavior is non-compliance due to limitations in hearing. Are they able to hear the prompts that you're giving them? Or when you're asking them to do something, are their visual impairments actually impacting their ability to comply, or they're frustrated because they can't see what you're asking them to do, or some of those things. So we want to make sure you have a really good understanding of those medical and other sort of physiological problems, so that you can have that information as you move forward with any sort of behavioral treatment. Some other sort of best practice general first steps, if it's a new behavior that you're seeing, so maybe they've just started throwing things, mildly when they're playing, think about what could be going on. Are these toys that they've had for a long time? Maybe they're just bored and we need to mix it up a little bit. Add some more stimulating activities, update the schedule, rotate things more often as to what they're doing. And if you've tried some of those basic things or sort of looked into some of those, then you may want to start seeking out more appropriate behavioral services. I feel like I'm asking more questions than I'm answering here. So what are appropriate behavioral services? So generally, I'm going to first recommend that you try to find a provider who practices and uses the theories of applied behavior analysis. And I'm going to talk about what that is. Ideally, it'd be great if you look into interdisciplinary settings where there's behavior therapists, speech language pathologists, potentially medication providers, and other team members, OT, PT, some of those things, because a lot of this is really about collaboration and looking across a child's whole kind of development and how all these things go together. So what is ABA? ABA is really just one approach to understanding behavior. However, it has a long history of evidence-based practice, probably getting close to over 50 years of success, particularly with children diagnosed with a wide range of developmental disabilities. A lot of people unfortunately think it only works for children with autism, but really it works for everybody, including ourselves, as well can be effective for individuals with 1P36. And really the biggest piece about ABA is that the goal should be to increase each child's independence and functioning in the community. So a lot of my emphasis and what I do is reducing that problem behavior, but that's to allow for other providers to then focus on increasing independence, adaptive life skills, and kind of putting all of that together. So when I talk about it being applied, that's a focus on identifying goals that are socially significant. So for any of you who've accessed ABA, or if you're going to pursue it moving forward, the main conversation that should happen at intake is that someone is asking you, what are the goals that you have for your child? It's not about a clinician goals, and I'm guilty of it myself sometimes. I get my behavior analyst hat on and I might get a little blinded, but I always come back to saying, is this important to you? Are we working on something that's important to you and your child? And making sure that you guys continue to be the excellent advocates that you are for your child and your family's needs. Again, a lot of what I focus on is decreasing those maladaptive behaviors, but then other providers can work on more of those teaching adaptive skills, like brushing teeth independently, toilet training, and communication, which is a big one and a big theme of what I'll be talking about today, as well as increasing compliance with academics, but also just around the house, working on those life skills of cleaning your own room and helping around in the kitchen and doing some of those chores. And everything should be approached that each person is an individual. So again, I have lots of ideas based on some of what you guys have shared with me today, but I can't answer all the questions because I don't know your child at the individual level, to really know what is going on for them and how to make those really meaningful changes moving forward. So when we're talking about the behavior in ABA, again, that can be all range of behaviors of interest. So problem behaviors, communication goals, engagement with toys and independent play skills, compliance. As I've said multiple times, our focus on the NBU is generally to teach children that there are consequences for their behavior, both good and bad, and really focusing on reducing those problem behaviors and starting to build a foundation of those replacement appropriate behaviors. And then the analysis part of ABA is just what I've said. We try to identify why a behavior is occurring. So we use basic principles like reinforcement that I'm going to talk about and get a little technical in a few minutes to try and change behavior for the better. So we look at the child's environment, and I think that's a big thing that people don't understand all the time, is that while we work on developing skills within the child, a lot of that is based on making changes in that child's environment, and that includes all of you, their caregivers, their siblings, their teachers, as well as the environment itself in terms of making modifications, how we set things up in their environment to help them be more successful. So overall, it's teaching them that these problem behaviors no longer quote unquote work, and I'll get to more of what that might mean, and then sort of reduce their motivation to engage in the problem behavior by giving them a more appropriate way to access those things that they want. Who here's heard of the ABCs of ABA? I know at least one person brought it up to me yesterday. No? Okay. So when we talk about the ABCs in ABA, it's a three-term contingency. So the A is what we call the antecedent. So that means what's happening right before a behavior occurs. And then the B, pretty self-explanatory, the behavior of interest. So that could be aggression, that could be something more appropriate like appropriate communication. And then we have the C, the consequence. So what happens in response or after a problem behavior occurs. So here in my example, you see a child is presented with schoolwork, that's the antecedent. The behavior is that they respond by hitting their teacher. And the consequence is they say, okay, never mind, you can take a break, you don't have to do your work just yet. So that sequence of events is what we call, sorry, I get a little technical here, these three-term contingencies. This is something that you guys as parents are capable of just starting to think about. When a problem behavior happens, once everybody's safe, take a second and think back, like what happened before, what happened after, and that might help you start to develop some hypotheses and questions as to maybe why your child's engaging in these problem behaviors. Wow, I just answered my own question. So why is that? How are you going to narrow down? Lots of things happen before, lots of things happen after. How are you supposed to figure out this ABC contingency in those moments? Well, if we know some of the medical problems may have been ruled out, sometimes it's just tiredness, and that's fine. When you're tired, you're going to engage in some problem behavior. Or you're feeling hangry, you might engage in some problem behavior. But other times you're going to say, no, those things are not what's going on. This isn't about something like that, or pain or anything there. So the most common factors that we found throughout years of research is that most times kids are trying to access attention, access some preferred item, food, toys. They're trying to get out of doing something, whether that be a demand, whether that be going somewhere, whether that be avoiding some sort of a person, self-stimulation or sensory sorts of needs, and across all of it, probably some lack of communication as to why the child's engaging in problem behavior. So that might help you narrow down, if you start to think about these ABCs, what could be going on, or what are the resulting consequence of their behavior. Okay, so here's getting even more technical. Sorry, bear with me. The terms reinforcement, and on the next slide I'm going to talk about punishment, get thrown out a lot. And here's my sort of PSA to try and help you guys get a better understanding of what reinforcement and punishment really mean. So a lot of times people hear reinforcement and they just think, oh, that's just giving rewards, that's just giving treats for good behavior. And to some degree that's true, but when we're really thinking about it from a behavior analytic standpoint, it's the impact that something has on behavior. So if something is reinforcing, that means that we see the behavior that we want to see, so something like appropriate communication, we see that behavior happen more often. So I've had parents say, oh, reinforcement doesn't work for my child. And I'm like, okay, well, that to me just means you haven't found a good reinforcer, because we all have reinforcers, right? But we can't assume to know what every child's reinforcer is. Some people like snacks, other people don't. Some people like alone time, and that's their reinforcer. Certain toys, certain activities, all of those things need to be identified at the individual level. So to get a little more complicated, when we talk about reinforcement, we also have positive reinforcement and negative reinforcement. Now, again, most people assume that means good and bad, but really I want you to think about it like math. Positive is adding something, negative is removing or subtracting something. So when we talk about positive reinforcement, you can see some examples there that you get your allowance because you did your chores. If that's reinforcing, you're more likely to do your chores to get that allowance. You get treats, you're going to more likely to engage in whatever behavior got you those treats, or something like staying up late if you've done all your homework or something like that. And then negative reinforcement, again, is the removal of something to increase that behavior. So if you finish all your homework early, maybe you get a break from doing more work. That's removing the work and you get a break. An example that's probably relevant to all of us, sometimes those alarm clock sounds are not enjoyable, right? So the turning off of the alarm clock, removing that sound of the alarm clock means you're more likely to do it again, right? You're increasing how often and how quickly you're turning off your alarm clock. Or something like taking medication. If you have a headache, you take medication and your headache goes away, taking the medication is the behavior, it's removing the discomfort that you're having, that's negative reinforcement because it's increasing the likelihood you're going to take that medication again in the future. Hope you're bearing with me. I know that's a little bit complex. So reinforcement is only reinforcement if you see an improvement or an increase in the behavior that you want to see. And like I sort of mentioned, there may be a difference between what you think is reinforcing and what your child thinks is reinforcing. So that's a really important part of all of this. You guys are the experts on your child and you know them better than anybody, but you still might need to think about, wait, is this just something they like, or is this something that could be seen as reinforcing and that they want to actually earn it by doing the good behaviors? So on the flip side, we do have punishment. And basically it's the same thing, except that something that is punishing is going to decrease that likelihood of that behavior happening in the future. We have the same thing, the positive, the negative, so adding something or removing something. So some of these are more sort of naturally occurring consequences. If you're running around the pool and you fall and you hurt yourself, that's actually considered positive punishment. You've added something, you've fallen and hurt yourself, so you're less likely to run in the future, right? Falling and hurting yourself has resulted in you saying, ooh, I'm not going to run again. You've decreased that possibility that you're going to run around a pool in the future. And then something like a speeding ticket or paying a fine for speeding, in theory, is supposed to be a negative punishment, that you speed and then something gets taken away, your money, because you've speeded, and then hopefully you're going to not speed in the future. So that's considered a negative punishment there. Same thing here, there's a difference between what we think is punishing and what your child may find punishing. So timeout is one that's used a lot, but this is where getting into something I'm going to talk about in a minute. If you think that timeout is punishing, but we realize, oh, this child or this student actually wants to avoid certain situations, then a timeout's not going to be punishing. You're giving them exactly what they want, and that's not going to decrease the behavior in the future. And another sort of note, punishment-based procedures should really be used as a last resort. Anything that we're focusing on moving forward with behavior, we really want to emphasize the reinforcement piece, that we're finding ways to increase the behaviors that we want, and that's just naturally going to decrease those maladaptive behaviors. So another sort of PSA, if you're working with someone and they want to go right to some sort of punishment procedure, start asking some questions and ask about, well, what are the reinforcing behaviors that we're going to be working on, and sort of proceed with caution. Punishment can be a very useful strategy. I know it sounds very harsh. It can be very useful, especially for very dangerous behaviors, but we always, always, always want to try reinforcement-based strategies first. Okay, so why does this all matter? So really, again, it's all about understanding why behaviors are happening so we don't make accidental mistakes. Again, I sort of referenced this already, but one of the main things I see sometimes in schools is a child comes in, it's time to do work, and they flip over a table, so they get sent to the principal's office. And then the next day, they come in and do the same thing, and the teacher's saying, why isn't this working? We have this plan in place. If they flip furniture, they get sent to the principal's office. Well, then we explore that a little bit more, and we realize, well, this student actually doesn't want to do work. So when you say, go to the principal's office, again, they're getting exactly what they want, and therefore why would they be motivated to stop flipping the furniture? That's exactly how they want things to go. So we don't want to make those mistakes. We want to understand why the behavior is happening so that we can target that in a meaningful way. Oh, I just have some examples. So sometimes yelling is attention, and so yelling at a child who likes to get reactions from people can actually make the behavior worse, because that's not aversive to them. It's a big response, and they think that that's great, and so you're not going to see that change in the behavior. And again, something like timeout or removal from a situation can make a behavior work if the child just wants to get out of doing something. Excuse me. So how do we figure out the function? How do we figure out these whys? So one of the main approaches is conducting a functional behavioral assessment or a functional analysis. And these are ways to develop hypotheses. We may not know for sure all the time, but develop some strong hypotheses about that why, about the function maintaining the problem behavior is often how it's talked about. And this really helps us determine how to approach treatment. Again, if we know that a child engages in behavior to get that response, to get that attention, okay, well then we can target teaching them a more appropriate way to access that attention and to request for that. And this involves lots of data collection, so that's both those ABCs that I talked about, as well as looking at other variables in the environment. So here's some of the hypotheses, sorts of questions and some ways to think about it. So if you work through this with someone, or even start collecting your own ABC data, and you start to think, hey, this seems like it's self-stimulation or sensory seeking, or what we in the field call automatic, some things to ask about. Does this happen when your child's bored, when they're alone? Do they seem to like it? Does it occur even if they have access to lots of other fun things? This could mean that there's some degree of this self-stimulation going on, and sort of to put it into a picture, thinking about, and this is something we might not understand why, this is a hard one, right? The self-stimulation. I work with a lot of kids who have this function of behavior. I still can't explain why they enjoy it, what they get out of it, but our data support that that's what's going on, and it can still help us guide that treatment decision. So here, if we think about it, they engage in self-injury, they receive some sort of sensory stimulation that for some reason is reinforcing to them, and that's going to increase the likelihood of that self-injury occurring. So that's sort of that cycle of what's happening there. The more common ones, though, are things like this. If the hypothesis is to gain access to attention, does it seem like the behavior is occurring to get a response from someone? Do they get a big response, a reprimand, or attention from someone when they engage in the behavior? Do they engage in the behavior to get someone to come over to them, especially if maybe you're attending to a sibling? Is that when the behavior occurs most often, because your attention is diverted to someone else? Or similarly, does the behavior happen when you take something away, take the iPad away, take food away, or that when another person has a toy that they want, or it's clearly about getting something that they want? Both of those are what we call that positive reinforcement, right? The behaviors are getting something added, the attention, or that preferred item back to them. So the problem behavior is getting it back, that positive reinforcement, and we're increasing the likelihood of self-injury or other problem behavior occurring. So that's sort of that circular logic that we're kind of looking for there. And then the last main area is if the hypothesis to get out of doing things. Do they engage in the behavior when you ask them to do something, when they don't want to go somewhere, when it seems like they maybe want to be alone? Then our cycle looks something like this. A task is presented or a transition is presented. Problem behavior occurs. If they get out of doing that task, that's removal, that negative reinforcement, then we've just increased the likelihood of the problem behavior happening, and that cycle is going to continue. So now what? Now we've developed our hypotheses, and I should also say, rarely is it just one hypothesis. More often than not, it's multiple. So the answers are not always crystal clear, and so keeping that in mind, that there could be multiple reasons why any of these behaviors could be occurring at any given time. So now we talk about treatment options. So I am very involved in the behavioral treatment. We may consider things like protective equipment as well as medication trials. But honestly, most of the time it's a combination of some or all of these options that lead to the most successful outcomes. So talking about behavioral treatments, we use those results of that functional analysis, all that data that's collected, and then again, focusing on developing individualized treatment approaches that are based on those functions. So there's no one size fits all. Certainly a lot of what's done in ABA is working on those replacement behaviors, increasing communication. For those that I've talked with already, a lot of what we've talked about is how to identify appropriate communication abilities to replace those problem behaviors that are being used as communication right now. And often it's starting with one component at a time. I could be like, here's 6 things to try all at once, but that's not helpful for you and that's not feasible for you. So starting with one approach at a time, one component at a time, does that make meaningful change in the child's problem behavior? If it makes a little bit of change, okay, great. Let's maybe add something else in to see if that helps more. Or if it's not at all, okay, then we need to shift course. So there's that piece of it too. Just because you know the function, you know the why, there's different options that can be taken. And so sometimes that first option you take might not be the right one and you need to pull back and try a different treatment option. So that's why it can take time, because it's not just I shouldn't say ABC, but 1, 2, 3, there, you're done. It's figuring out what works for each individual child, even when those whys might be similar. When you're talking about goals, again, really focusing on the reinforcement piece. We want to be able to increase appropriate behavior that takes the place of what the problem behavior is doing right now. So we want to reinforce, we want to provide lots of praise, lots of access to things depending on what the function is, providing breaks if there's a problem, if the behavior is related to escape, for not engaging in those problem behaviors or for engaging in these appropriate replacement behaviors like asking for things, communicating on a device, any of those sorts of options. Other ways that you guys have the means to try out right now are just giving options to more reinforcer readily available, offering things on a fixed schedule, giving that time early on before problem behavior occurs. And then of course other goals may be trying to target academic compliance or compliance around the house. So some ways to do this, and some of this I've talked about with some of you already, are looking at some common treatment of components like differential attention or differential reinforcement, which I've sort of talked about, but we'll discuss more readily, using structured prompting procedures, and then maybe looking at items that can compete with those behaviors maintained by physiological consequences. So when we're talking about differential attention and reinforcement, I'm sure many of you have been told to just ignore the problem behavior. And while that in practice is part of a good approach, it's really just that part of an approach. The bigger thing here is wanting to identify ways to provide attention, to provide reinforcement in response to one of those appropriate behaviors. So appropriate communication, just tolerating a situation that maybe has resulted in problem behavior in the past, and providing access to your praise. And this is something regardless of the why. You can be doing this with your attention all the time. Your praise and your response to both maladaptive and adaptive behavior is a really powerful tool that you guys have all in your pocket. But what I would caution against is just ignoring problem behavior, because if your child has no way to access what they're currently accessing through problem behavior, rightly so, they're just going to get more upset. And that's something that we call an extinction burst. So if you think about, hey, every time I've hit myself, you've given me my iPad. Now I'm hitting myself, you're not giving me my iPad, but you've also given me no other way to access my iPad. Then we're setting them up to be very, very frustrated and can make that situation much, much worse. So this is something that you'd really want to be working with a team, with a speech language pathologist, with your school team, to be targeting those replacement behaviors and finding ways to allow them to, again, ask for the iPad appropriately, and then limiting those responses to problem behavior to try and start flipping the script on how they're learning to access things, to request things, to gain the things that they want in their environment. Prompting procedures is another thing that can be really helpful as both a teaching tool, but also just teaching expectations. So we often recommend using a very consistent prompting sequence whenever you ask your child to complete a task. So like I said, this helps them understand what's expected of them and also helps them prevent them from getting out of doing something. Within the NBU, we often use what's called 3-step prompting, or least to most prompting, if that's a term any of you have heard before. And involves using the least to most invasive method. Invasive sounds really harsh, but for following through on a demand. So we would give a verbal prompt, pick up the, ooh, that's gonna fly away. Pick up the microphone, or I would say, pick up the microphone, and then I would wait for compliance, and then I would say, pick up the microphone like this, and model what I'm asking for, and then wait, and then have them hand over hand saying, this is picking up the microphone. So sometimes when you're delivering a prompt, it may just be that your child doesn't know what you're asking them to do, or it's too many steps and it's too complex for them. And so this is actually a really helpful tool for parents as well, to recognize, what am I asking? How many things am I asking? Am I giving my child an opportunity to actually comply with what I'm asking, and do they understand what I'm asking to do? So something like this is an approach that you can take, again, working with your school team, to recognize that you can teach them using a structured prompting sequence, and also target those problem behaviors by not allowing them to get out of an activity, and providing ways to praise compliance following that independent prompt or that gestural prompt moving forward. And then lastly, something that you can explore is providing alternate sources of stimulation. So the hand biting is a big issue for many kids. You know, are there things that we can allow them access to bite on that would be safer, that starts to replace them biting on their hand, and allows them a way to access that sensory reinforcement that they seem to enjoy, that they seem to be getting out of engaging in that self-injury. This also can work towards teaching toy play skills. So, you know, keeping their hands busy with other things. It doesn't have to be just something that they can bite on or chew on, but working to teach toy play skills can be a great way to target some of those behaviors that might be maintained by that physiological consequence. Sometimes the behavior can be very severe and persist even after all of these sorts of behavioral treatments have been evaluated, and protective equipment may be needed. This is really something that should be evaluated with someone and looking at the most therapeutic option, so nothing too invasive. So as I think Scott referenced the other day, you know, we have children in our unit who sometimes require helmets or arm restraints that don't allow them to bend their arms. Those are things that we take very seriously to evaluate in terms of identifying the safest level, but also something that allows therapeutic options. But I just want you to be aware of that this could be something that needs to be explored, again, with providers who are able to assist you with this, and help make sure that you're finding that balance of safety, but not impacting your child's ability to be independent and participate in their community. And then medication trials. So no single medication has been identified to target self-injury. There are a couple medications that have been approved through the FDA to target signs and symptoms of irritability in individuals with autism and other developmental disabilities. So you definitely want to be consulting with a psychiatrist who has experience with treating individuals presenting with problem behavior, because there's lots of different pros and cons to certain medications, and trying to target not just self-injury, but some of those other symptoms of agitation, as well as other areas that might impact behavior. So if your child's not sleeping, I know if I'm not sleeping, there was a party going on next to my hotel room last night. You know, if I'm not sleeping, I'm going to be a little bit more agitated or irritable perhaps the next day. So that might be something you want to discuss with your primary care or with a psychiatrist, targeting sleep and seeing how that helps with any of the problem behaviors you're experiencing across the day. So most of the time, like I said at the beginning, the best outcome is often some combination of behavioral treatments, medication, and then potentially some of that protective equipment. Another big consideration is school. So if your child's problem behavior is impacting their ability to make progress in the school setting, the school is required to complete what's called a functional behavioral assessment. So it's a little bit different than what I was describing before, but it is still all about collecting that data, seeing why in the school environment, why is your child engaging in those problem behaviors, and then the team can use that data to develop a behavior intervention plan or a BIP. These should be reviewed regularly, and by reviewed I mean looking at the data. Data needs to continue to be collected upon the implementation of that behavior plan to make sure that you're seeing that change. And sometimes, again, it's not immediate. Sometimes there's going to be little changes or some changes in some areas but not in others, but making sure that that's being evaluated on a regular basis and making the changes that are needed to start working towards that truly meaningful change in behavior. And again, just emphasizing that it must include that measurable data collection system. And then it's really important that you guys are able to work collaboratively collaboratively with your school on that FBA and that BIP, because sometimes strategies that work at school can also work at home, adapting a little bit. So don't reinvent the wheel. If you guys know something that works, help the school out. If the school finds something that works, ask them to help you out, and making sure that you're all working together to provide the best level of support for your child, because most of the time some degree of consistency across settings is going to be really vital for that continued success. So sort of wrapping up here, it is possible to decrease these problem behaviors in individuals with 1P36. It's really important that you guys maybe start monitoring those antecedents and consequences, the things that happen before, the things that happen after these concerning behaviors, and start to become little behavior analysts in training and develop hypotheses about why the behavior is happening. Start to figure out those functions. Then find someone to help you work on strategies to decrease the problem behavior and increase those appropriate behaviors, making sure that they're taking that data so you know it's working. You can see that your things decreasing or those appropriate behaviors are increasing, and then that you're implementing these strategies across the day, across caregivers, across contexts. It might mean you slowly start to incorporate some things to your day, but working to the fact that everybody's going to be responding in the same way across multiple contexts. And the biggest one is just be persistent. I can't emphasize that enough. It does take time. Kids are challenging, and everybody is so unique and individualized. It's going to take time to figure out the most effective way to target both these problem behaviors you're reducing as well as the appropriate behaviors you're trying to increase. So just don't give up. Keep seeking help. You're not alone in this. I'm happy to try and help you identify resources. If for those of you I don't get to talk with yesterday or today, to try and find resources in your area. But some places that you can get started are to look at the Behavior Analyst Certification Board, or the BACB, and you can click to find BCBAs in your area. So that's one option, as well as just contacting your insurance carrier and asking for a list of in-network providers, specifically those that may be behavioral psychologists, behavior therapists, or BCBAs. You also, I didn't mention on here, but speech language pathologists are also a great resource in terms of targeting those appropriate communication skills and starting there as well. All right, so thank you. I guess I have a few minutes for questions.
I'll grab a mic real quick. Does anybody have any questions?
Thanks. Thank you. I kept thinking that we should have this course when when maybe want to become parents or something, what have you. The FBA and BIP, could that ever be done in the context of both home and school? I love the idea of working, and implementing at home what could be done in school, but unfortunately the school that he goes now kind of totally, I feel that they separate home from school, which I can't understand, and they belong to KKI, so maybe we should have an offline conversation. But how can we, because some of those intervention plans are targeted for school, right? And maybe some of those behaviors, we don't find them in home, right? So then, could school ever be allowed to do this type of FBA in both environments, or just have the BCBA do an FBA at home and try, how do you envision that? And then that's my first question. And are there I don't have the bandwidth now, but I would love to become a BCBA. I actually was told by one of the providers, why don't I go become one? Because we know there's so very few of you, right? And the need is huge. But are there parent trainings that, one, preferably free if possible, that you can share with all of us? Because, they might exist and we don't know them. So.
Sure. So to your first question, unfortunately I think that really depends on the school. So part of the FBA process should include collecting information from the parents. So whether that's completing some different measures that start to look at asking those questions, why are these behaviors happening? Are these behaviors happening at home? But then I think it depends on the school as to whether they have the capability to really do an assessment at home. But I think through the FBA process and developing the BIP and then in IEP meetings, if the team is showing you data that say, hey, these interventions work, I feel very strongly that you have every right to say, hey, so which ones do you think I could adapt at home? And maybe they can't fully come into the home and tell you exactly what to do, but certainly as it relates to communication, those are the kinds of things that I feel strongly that they should be required to help you learn, like, hey, what are you doing to have him communicate for these things at school, and how can I start to introduce those at home? I don't know many schools that would come into the home to do those assessments, but they need your input about some of these things, and certainly should be able to help you problem solve using some of those strategies in the home. In terms of your second question about parent training, there are certainly a lot of things online through, a lot of times it's maybe through like the Autism Speaks website, where there's ABA related resources. So I can look into some of those. If you know anybody in your area, any ABA agencies, many of them actually do provide a lot of free parent training webinars. It's just a matter of knowing where to access them. So that would be something that even through that BACB website, you might be able to reach out to someone in your area and say, hey, do you have any access to parent training resources that I could access through this local community? Yeah.
Thank you very much for your talk. It's just full of such wonderful information. I was wondering if there was some way I could access your slides. I just couldn't, I wouldn't be able to retain it all from
Certainly, yes. I can send them to Ken or to the Winnickes and get them access to you. Yep.
Thank you very
Yes.
much. It was wonderful.
You're very welcome. Oh, over there.
So the problem that I'm dealing with right now is that it seems like Marcello, he hits himself with his arm. So I tried a few things, obviously, to get him to stop. But I feel like every bullet point is what sets him off. Like, he wants attention, he hits himself. He's bored, he hits himself. He's hungry, he hits himself. He wants stimulation, he hits himself and he laughs.
Yeah.
So I don't really know how to attack it. He does it in school, he does it at home, he does it if he's tired, he does it if he wakes up and his sleep is disturbed. So it's like, it's like a cycle. And then the other part of it is that he also, which you said is huge, he bites his finger. Which, it doesn't bother me as much as hitting himself, but he also has very limited, I don't know how to explain it, but he doesn't do much. He doesn't play with toys. I can set him up in front of something, I can play with him, his siblings can play with him, he can watch shows, stuff like that, but I can't give him something to distract him from this. He doesn't hold anything. He doesn't pick up anything or grab anything, so I can't say, like, here's a chewy tube, don't chew your finger, So I don't really, even, like those necklaces, I can't give him anything. So that's another thing. I've resorted to like a glove that I actually couldn't find one that fit his hand for a 6-year-old, so I had my aunt make one. So it has a chewy thing on it so that he could still put his hand in his mouth, but not attack his finger as much. So I just don't, I'm at a loss here on what to do for him.
Yeah, and I think that goes back to some of the questions those I met with individually. One of the first questions, if I were to start working with you, would be, well, how is he able to more appropriately get access to all of those things? The attention, getting things he wants. How is he able to communicate with you? And if he doesn't have those those skills just yet, you know, again, this is where it goes to, it takes time. And so if those behaviors are occurring at the extent well, they are occurring at the extent you're describing, you know, that to me sounds like the time to really pursue those more intensive behavior services, because it's going to take a lot of time to teach him to communicate, to teach him to maybe engage with things more appropriately that might help decrease him engaging in those problem behaviors. So if you don't know where to access those supports in your areas, I'm happy to try and help you find those, and you can reach out to me and we can see if we can problem solve where you can kind of start to find that more intensive services to help you figure that out, because it'll take time. Yeah.
I think that's all the time you
Okay.
have for questions.
Great, thank you
because-
everyone.
Yes, you get to move right on. Thank you so much.